Hi, I'm Janine and I'm presenting this PowerPoint on prostate cancer and the role of the prostate cancer specialist nurse. So, the role of the prostate cancer specialist nurse is to support patients who have been diagnosed with prostate cancer. This support also includes family and carers of the men. It is multifaceted and is included but not limited to the list below. With education, we provide detailed information on grading of cancer, treatments associated with particular grading of cancer, potential side effects associated with treatments, and expected outcomes of these treatments. We help patients and families understand the disease and the impact it will have on their lives. We offer compassionate support, listen to concerns. We make it known that they can contact us with any worry that they have about their diagnosis and help alleviate any anxiety or depression that they may be dealing with due to their diagnosis. We make onward referrals where required. We liaise between patients, doctors, and other healthcare teams to ensure all aspects of care are coordinated effectively. That is, we can arrange appointments, referrals, transport to appointments, referrals to social work, or psycho-oncology, cardio-oncology, or anything that is needed. With monitoring, we do regular check-ins with patients on treatment and usually for 2 years or more post-treatments, as some side effects of treatment can be long-term. We offer advice on managing symptoms of treatment and ensure any changes in the patient's condition is addressed promptly. With decision making, prostate cancer treatment often involves multiple options, including surgery, radiation therapy, and hormone therapy. Specialist nurses help patients to understand the pros and cons of each treatment option, and we support them in making informed decisions. Post-treatment, we continue to provide support with rehabilitation, managing side effects, and addressing concerns about recovery and quality of life. Well-being, we promote good quality diet and exercise to improve patient outcome throughout and post-treatment. And with advocacy, we ensure the patient's voice is heard in the healthcare system and that they receive the best possible care and treatment options for their individual circumstances. So, diagnosis of prostate cancer, it follows a bit of a regime. So, it is based on a series of tests. A high PSA test will lead to an MRI. In the event that the PIRAD score shows a likelihood of prostate cancer, a biopsy will then be ordered. If the biopsy comes back positive, a PSMA PET scan will then be arranged. So the normal PSA range depends on the age of the man, prostate size, ethnicity, current medications they're on, current urinary functions, exercise, like if they've been riding a bicycle, if they do any sort of vigorous exercise, that can increase the PSA reading, as can recent sexual activity and prostate stimulation. So MRIs are used to ascertain the likelihood of prostate cancer. PIRADS 1 is very low risk. Clinically significant cancer is highly unlikely, all the way up to PIRADS 5, where very high risk cancer is highly likely. A PIRAD score of 3 or higher typically leads to a recommendation for a biopsy. So with the prostate biopsies, a grade is given to the core samples taken from the biopsy, which we'll talk about in the next slide. Then a PSMA PET scan. Men who have positive biopsy results who are graded with intermediate or high risk disease then have a PSMA PET scan. These scans are used to determine if the prostate cancer has spread beyond the prostate. This scan plays a significant role in determining the type of treatment pathway that the men will go down. Unfortunately, though, the PSMA PET scan is unable to pick up microscopic cancer cells that have escaped the prostate, so it is not 100%. PSMA PET scans are also used if a man has had a previous treatment for prostate cancer And if his PSA level has risen, then they will often do another PET scan to see if there's recurrent prostate cancer anywhere else in the body. Grading of the prostate cancer. So Gleason grade 1 and 2 are very rarely used. Therefore, the lowest number used in the grading score is 3. To get the Gleason score that is shown on the table on the right, the two most common patterns of growth seen in the biopsy samples are each given a number from 1 to 5, as per the visual on the left-hand side. And then these two numbers are added together to give the Gleason score. So if you have a 4 plus 3 equals 7, Gleason score is 7. Grade group or ISUP grade is now also being used to decide the level of risk for each cancer grade, as it's easier to understand and is more accurate than the Gleason system for predicting how quickly a cancer will spread. This system uses 5 grades. Grade group 1 is low risk, grade group 5 is high risk and the most aggressive cancer. So treatment for prostate cancer. There are a number of treatments, and as I said, it all depends on the grade group and so on. So active surveillance, treatment options for those with low risk cancer and some intermediate risk cancers, and it involves monitoring for changes in the cancer, and that is done by the PSA and plus or minus another MRI down the track and a prostate biopsy. Surgery is the removal of the prostate, and it's either open radical prostatectomy, laparoscopic radical prostatectomy, or robotic assisted radical prostatectomy. Radiation therapy is external beam radiation treatment, which uses high energy X-ray beams directed at the cancer. Brachytherapy is another form of radiation therapy, and its radioactive material is inserted directly into the prostate. That can be either high or low dose. ADT, which is androgen deprivation therapy. These injections are used to block testosterone. Androgen receptor pathway inhibitors are usually in a tablet form, and they block the action of testosterone on the prostate cancer cells. So it's another way of just using the hormone there. Chemotherapy is a common treatment for metastatic or advanced prostate cancer, aimed to kill cancer cells and slow their growth. Sorry, go back one. Side effects. So prostate cancer treatment can involve several approaches to treatment. However, each comes with potential side effects that vary in severity and duration. With surgery, urinary incontinence ranging from mild leakage to full loss of bladder control. Erectile dysfunction, often due to nerve damage during the surgery. Infertility, removal of the prostate leads to dry ejaculation. Pain or discomfort, which is generally short-term after the operation. A change in penis size due to the removal of part of the urethra and rejoining it to the bladder neck. Radiation therapy, some of the symptoms relating to that include fatigue, which builds up over the course of treatment. Urinary problems, now these can be short-term or long-term. There can be frequency, urgency, burning or incontinence, or even some blood in the urine as well. Bowel issues also are short and long-term. There's diarrhea, rectal bleeding or discomfort. Erectile dysfunction. So radiation therapy treatment tends to speed up the aging process when it comes to this, so it develops over time post-treatment. Skin irritation, so redness and tenderness in the area that's been affected. Hormone therapy for prostate cancer is used to block or lower testosterone, which fuels cancer growth. It slows or shrinks the tumour using drugs to suppress or block androgen production and activity. The decline in testosterone is the case of the majority of side effects that are listed in the table there. It usually takes the equivalent amount of time to get out of the system as the length of time that the drug has been taken for. So if a man was on 6 months of ADT, then it would take another 6 months or more for the recovery of testosterone and for all of those symptoms to get out of his body. Chemotherapy for prostate cancer uses drugs like docetaxel to kill fast-growing cancer cells, especially in advanced or hormone-resistant cases. It's given in cycles and may extend survival. Common side effects include fatigue, nausea, hair loss, infection risk, appetite loss, and nerve damage or neuropathy. Survivorship, it's very important, survivorship for these men. We play a critical role in supporting them throughout survivorship. It starts from diagnosis and continues through the prostate cancer treatment and recovery, and with the goal of long-term quality of life. So we do clinical follow-ups and monitor, coordinate PSA monitoring to detect recurrence early. We recognise and manage late side effects of treatment. That's either urinary incontinence, erectile dysfunction, bowel dysfunction, hormone-related issues such as hot flushes, fatigue, and osteoporosis. We assess and manage comorbidities. We assess and provide psychosocial support. We screen for emotional distress, anxiety, and depression, provide access to counselling and support groups. We support relationship and intimacy concerns, offering referrals where needed. We also encourage open discussion about sexuality, masculinity, and identity. We promote health and self-management and educate men on healthy diet and physical activity, weight gain and weight loss, and so on. So we would refer them on to dietitians and so on for that sort of thing. We promote self-monitoring and empowerment in managing side effects. Survivorship care planning, as I said, it's very important in prostate cancer. We develop or contribute to the personal care plans, coordinate multidisciplinary inputs with any of the allied health team. We ensure continuity of care across hospital and community settings. Communication and advocacy. We are the central point of contact for patients and families. We advocate for patients' needs within the healthcare team, and we provide tailored information and discussion support around ongoing and future treatment options. Right, that's it. Thank you.